My name is Sridhar Venkatapuram, and I am an associate professor in global health and philosophy at King's College London Global Health Institute. Welcome to my X. How can we understand the relationship between health and social justice? And I think the best way is to begin with our understanding that health is created and distributed in society and not only in the hospital or clinic or research laboratory. And so how can we understand what health created and distributed in society means and what are the ethical implications for that? And I think the first place to begin is the profound amount of knowledge that has been produced in the field of social epidemiology, which is a kind of sub-discipline of epidemiology, or some people say actually all epidemiology in social is social. What they are looking at and what they're studying is the causes and distribution of disease and also health in people. Let me give you an example about obesity and the high propensity of obesity in certain cultures. So if we only take the view that obesity is about what an individual is eating or drinking and the lack of exercise, then our interventions are only going to be about trying to get that individual to change their behavior and their beliefs. But what we mean by addressing the social determinants and what we mean by trying to change the social gradient is that you actually change the environment around that individual and all those individuals that are affected by obesity. So for example, do they have access to nutritious food? Is it that they're eating high density, high caloric food because it's cheaper and that's what the only thing that they have access to in these neighborhoods? In many poor neighborhoods in the United States, for example, there is no grocery store that sells nutritious food, but there is grocery stores that will sell you high density, high caloric food because it's cheaper and high in carbohydrates and processed sugars because it's cheaper. And the food and the restaurants that are available tend to be poor nutritionally wise, but they will be large quantities of food and cheap and affordable. So the idea is to address the conditions, the social conditions that can actually improve the default options for different individuals so that they can impact their weight, their nutrition, their exercise. One of the most profound examples of this is the regulation of tobacco, particularly in rich countries such as Australia, United Kingdom, and the US. So rather than telling individuals to stop smoking and expect that to be enough, what's happened is that there has been legal intervention that essentially makes it impossible or very difficult for cigarette companies to sell cigarettes to minors. They are also no longer allowed to advertise smoking or any cigarette products. Their packaging is no longer allowed to have any kind of advertising. And all of these kinds of more on a population level interventions has transformed or reduced the amount of smokers in these societies and basically has come down into significant levels. So that would be what we would call a social level intervention to address a social determinant of disease. Now, there are also other kinds of interventions. If you think about seatbelt laws, is that rather than telling each individual to say, wear a seatbelt for your own benefit, when you actually change the background social norm and conditions, that would be something that we would call as being a successful intervention. I would say kind of a very focused yes, which is that rather than keep emphasizing the idea that health is something that happens in the clinic or in the hospital or in the research lab, that health is actually something that happens in your daily life, in your household, in your community, then it really does make it important that people understand what is it in my daily life, in my neighborhood, in my household that is healthy or that causes health, or what is it that causes disease. And so, and trying to get people to understand those kinds of pathways. But at the same time, there's very little an individual and a household can do if there is a profoundly toxic environment that is sort of near where they live, or there's very little a household can do on their own if there's a government that does not value the health of its people or want to address health inequalities, or there's very little even a country can do if there's international trade systems that are not supportive of health and addressing health or improving health equity in a country. So while people need to reimagine and re-understand the causes and distribution of health in their daily lives, the points of intervention actually have to be different and have to happen at different places. And that's really where the ethics comes in, about the political ethics and the social ethics that motivate a greater understanding and value of health, and understanding the places of intervention and the ability to get those things on the agenda to make changes in policies.